Over the course of the life of FCAA, we've evolved from a group of local grant makers addressing a local epidemic to becoming a global network of funders addressing an international pandemic. In our last strat plan, we contemplated the intersections that we needed to work at, but in our new strat plan, the intersections really become the focus of our work. Bringing funders who don't consider themselves HIV funders into the circle to understand how they can have an impact on HIV and how their issues overlap with HIV. We've gone from being a monitor of the epidemic to a driver of a global health response. The new plan seeks to move us closer to the end of the HIV epidemic by increasing funding for empowerment, equity, and justice, by focusing on innovation in health care and human rights, and by holding governments accountable. These changes are really needed to get us to the end of the epidemic. We've made tremendous progress in treatment and prevention, but we still have marginalized communities that are overburdened by the epidemic and under-resourced. And increasingly, we're facing a divide between places where the epidemic is almost over and places where the epidemic is really raging. And we really need to even our progress and make sure that the advances really affect everyone. HIV-informed grant making means that we take the lessons learned over the last 40 years of responding to the HIV epidemic and apply them to ending the epidemic, but also to addressing the root causes of the epidemic. So HIV-informed grant making means putting those most impacted by the disease at the center of the response. It means using a rights-based approach to grant making and to understand that we can't eliminate an epidemic without addressing the social drivers that create it. We're seeing this play out again with COVID, and we're also seeing HIV-informed funders taking the lead in responding to COVID with their resources and with the infrastructure built to respond to the HIV epidemic. FCAA can inform, connect, and support funders in a lot of ways. First, our resource tracking report, released each year, shows where the global philanthropic response to HIV is, and more importantly, shows where the gaps in the response are. FCAA connects funders through our annual convenings, through periodic webinars and other in-person and virtual events. And we support funders in collaborative efforts such as the Southern HIV Impact Fund, the Racial Justice Working Group, and the COVID Learning Group. Funders can connect to us and these activities by visiting our website or connecting with us on social media.